came in, there was evidence that your body was retaining fluid. And one of the more common reasons that the body retains fluid is that the circulation gets sluggish. When the circulation gets sluggish, the kidneys interpret that as being dehydrated, and so they start to retain fluid. In fact, you're not dehydrated, you got too much fluid, and the body's got to do something with it, so it parks it in the legs or the lungs or the abdomen. So, as we started off, they started with some medicine to help your body make the kidneys get rid of fluid, and we got a bunch of that extra fluid off, and that's kind of when your breathing started getting better and you started feeling better. But then the question is, well, why did this occur in the first place? And so that was part of, well, a number of tests, but the primary test was this echocardiogram, the sound wave test of your heart. And what that looks for is how well the heart squeezes, how well the valves of the heart, and the valves in the heart keep blood going through the right way, and how well they're making sure that they're opening and closing normally and not leaking. And it also tells us about how thick the heart muscle is, and not only how well it squeezes, but how well it tends to relax so that it can fill back up. On your echo, we found that the valves looked fine. They were doing what they need to do. The heart muscle was just a little bit thickened, and when it squeezed, it didn't look like it squeezed quite as hard as it should. And also then when it was wanting to relax, it didn't look like it was relaxing as quickly as it normally would to fill back up. And as a result, the circulation was sluggish, the kidneys start retaining fluid, and that's what kind of gets this started. What we check, or the way we measure that is by, on the echo, we can calculate what's called an ejection fraction. And that's just simply a measurement of when the heart's completely full of blood and it contracts, how much of that blood does it push out into the circulation and how much does it leave in the heart. Normal is about 50-50. So for every 100 cc's of blood that's in the heart when it's full, when it squeezes, it pushes out about 50 cc's and leaves about 50 cc's in the heart. Kind of like keeping a pump primed, if you will. Your number calculated to about 45%. So that was a little bit, 5 cc's, or basically a teaspoon, less going out than we would consider normal. Sometimes that's all it takes to cause symptoms. So we wanted, and the reason for the test today was to see if we could figure out why that ejection fraction was a little bit low. Because one of the common reasons for that is that some of the blood vessels that take blood to the heart muscle, that provide blood and oxygen to the heart muscle, are kind of blocked and not letting enough blood get there. And so if that muscle doesn't have enough oxygen, it can't squeeze as hard. So if you'll recall, on the test that you had today, they do a set of pictures when you're resting before they give you anything. Then they give you that medicine in the vein that makes you flush and whatnot. And then they take another set of pictures. Well, what that medicine that they give you that makes you flush, what it does is it dilates the blood vessels. And the theory in this test is that if there's a blockage in any of those blood vessels that take blood to your heart, I say any of them, the main 3 blood vessels and their main branches are big enough that we can see them on a test like this. And so we compare those pictures to compare the blood flow, because the idea is if there's a blockage, when we dilate those arteries, we can see a difference in blood flow from one side of that blockage to the other. What we found is that we have really three main arteries that take blood to the heart. There's what's called the right coronary artery, which comes off and goes around the right side of the heart and to the bottom of the heart. Then there's what's called the left anterior descending, which is a big artery that comes down the front of the heart. And then there's what's called a circumflex, which is an artery that curves around the left side and goes to the back part of the heart, the left side and the back part of the heart. In your case, the one that comes to the right and goes to the bottom of the heart, there was a little small area where when they dilated it, it didn't seem to dilate like the rest of it did. And so there's a bit of a concern that there may be a little bit of a blockage in there, in that area. But having said that, with this test that you did today, we can also look at that ejection fraction, that is how well the heart squeezes. And on your test today, that was normal. So, the question is now, how important is this abnormality that we see on this test? Now, I have to qualify this by saying that the bottom part of the heart is the most difficult part of the heart to see with this type of test, because the big muscle of the diaphragm that expands the lungs is right there, and the heart sits there, and sometimes that can make that area look a little bit abnormal even when it's not, because of the closeness to the diaphragm. With what we found, I talked to the cardiologist, one of the cardiologists here, and kind of explained to her kind of your symptoms, what kinds of things you were having when you came in, what we found on your lab work, what the echo showed, what this test this morning showed. And this is one of those areas that's kind of in a little area of a gray zone. That it's not textbook normal, but it's not really abnormal in a way that proves anything. And so we really have, I guess, we're kind of at a crossroads. We've got two ways to go. One way would be to do another test that's a dye test to the heart. It's called a left heart catheterization. And what they do is they take it's like a big long IV tube, a heart catheter. Sometimes they'll put it in your wrist right here, sometimes they'll put it in the artery in the groin, and they run it up to your heart, and they actually shoot dye directly into those arteries. And then they can take a moving picture of it moving through the arteries as it goes out to the heart. And the dye test like that is really the definitive test to know if there's any blockages in those arteries. Okay? Now, the downside to the dye test is that it's invasive, meaning you got to get stuck with a pretty big needle. Now, it's not that bad. I had a heart catheterization about 9 months ago. They went through my wrist, and they give you medicine to they don't put you to sleep, but they give you medicine to kind of relax things, and it was not unpleasant at all. It was not painful to speak of. Sometimes some people will have a reaction, an allergic reaction to the dye. That's usually manageable, and it's not very common. Sometimes this dye, because when they put it in, ultimately it's cleared out by the kidneys, and sometimes it can temporarily injure the kidneys. So we don't do that as an everyday test because it has some side effects, but it is a safe test, and it is the definitive test to know about the circulation to your heart. She did though say that you got better so quickly and your heart function is so near normal that it would not be unreasonable to just give you a trial of treatment and kind of see how things go over the next several weeks. Well, what would that treatment be? Well, it would be an aspirin a day. And the aspirin is, when we take aspirin, not just for a headache, I mean, it helps with a headache, but it also makes the blood a little more slippery. And so if there is a little bit of a blockage, that the blood flow can get across that blockage a little easier. We would want you on really the aspirin and two other medications. One is a medicine called Toprol. It's what's called a beta blocker medicine. It really does two things. It slows the heart rate so that the heart has plenty of time to completely contract and push, but then also time to fill back up. So it helps to maximize the heart function. It also offers some protection to the heart muscle from damage. And then the other medicine is a medicine called losartan. And losartan is a medicine which helps to, for every time the heart beats, you get more flow from the heart than when you're on the medicine. That is, it's easier for the heart to push blood forward. So it can push more blood, giving it the strength of contraction. So there would be three medications. And I think that there's the overwhelming likelihood, that that's really, those medications are going to be the basic medicines that you need in terms of keeping this from happening again. So it really, I guess, depends upon how comfortable you are with having this little area in that right-sided blood vessel that we're not 100% sure about what's going on there. The way to be 100% sure is to do that dye test. But it certainly, we feel, would be safe to treat it medically, that is, without doing the dye test, and kind of see how things go in terms of how you're feeling, how your energy level is, how your breathing is, and whatnot over the next several weeks. And then maybe get you an appointment to follow up with the cardiologist in about 3 or 4 weeks. To follow up with the cardiologist in about 3 or 4 weeks. And then if there's any question, then that dye test can be done on an outpatient basis. You don't have to be in the hospital for that.
Yeah, I'm comfortable with the secondary. Yeah.
Okay.
So you got to go to the primary.
Okay.
Yeah.
Well, so the medicines are going to be the baby aspirin, 81 milligrams. Some people call it a heart aspirin or a circulation aspirin, but it's basically a baby aspirin. The second medicine will be called, the name of it, the brand name is Toprol XL. The generic name is metoprolol extended release, or ER. It's 25 milligrams one time a day. The third medication is called losartan. The other brand name for that is Cozar, but the generic in these are fine. And it's 25 milligrams as well, and you just take it one time a day. I do want to check one other thing. I want to see.
Video analyst James Kennedy ran the security camera images through a computer filter. Kennedy found specific.
I'll be right back. Let me check something on the computer out here. I want to just look and see what your cholesterol was. That might be something we need to address as well.
And there was
your cholesterol, and we worry about cholesterol because it is a risk factor for this hardening of the arteries, which makes these narrowed areas. And your cholesterol is really, what's normal cholesterol is kind of a moving target. In patients who have never had any trouble at all, don't have a family history of heart disease, don't have high blood pressure, don't have anything else going on, a total cholesterol of under 200 is considered okay, and a bad cholesterol or LDL cholesterol of under 130 is considered okay. And in that situation, your total cholesterol is 146, so that would be okay. And your bad cholesterol, your LDL cholesterol, is 103, so it would be considered good as well. But once you have something, in this case, this little episode of fluid retention and whatnot, and the abnormal imaging test, then those numbers get turned down, and particularly that LDL cholesterol, we want to see that less. We want to see it around 70 or less. And so, in that regard, there's some room to bring that down, and we can do that very well with medications. It would be a medicine called atorvastatin. The brand name is Lipitor. You may have seen commercials on it, Lipitor. But the generic is atorvastatin. It would be a 40 milligram tablet one time a day. So all of these medicines will just be one time a day. You can take them all at the same time if you want to. You can spread them out if you want to, whichever's most convenient. Yeah, you can take it, grab them down the hatch. They won't interact with each other and be done with it for the day. The manufacturer of the cholesterol medicine recommends taking it at night, but quite honestly, that's not mandatory. So if you find that taking them in the morning is easier, or if you find that taking all 4 of them at bedtime is easier.
Well, I'm going to work at 10:30 at night, and I get off at like 8:30 in the morning.
So if you could take yours right before you go to work, you'd be in good shape.
Yeah, that's what I was thinking.
Yeah, that'd be perfect. Yeah.
Pay the highway.
What pharmacy you want me to send these to?
The neighborhood in Wake Village.
Yeah. Neighborhood Walmart?
Yeah.
Investigators asked the
Neighborhood
toll
Walmart
collectors
in Wake
if
Village.
they recalled seeing a
I
yellow.
can send all of these over there electronically. Of course, the aspirin you get over the counter without a prescription, but the rest of them I'll send prescriptions over there for you.
Okay.
And get your orders in, let you go home in a little while.
Okay. Hey, sounds good to me.
I'm gonna have them, I think their office is still open. I'm gonna have them go ahead and set you up with an appointment with Dr. Doe. Megan Doe is her name. That's the cardiologist I talked to. She's very thorough and worked with her for a number of years. She does a good job and will be a good resource in terms of keeping up with this.
Scientists found skin cells on
She's off
several
of
tickets. They
probably
performed
Summer Hill Road.
mitochondrial
No, her office
DNA
is in the building right next to the hospital here.
compared those
The
DNA
part of the building that is facing the interstate, that's the physician office building. Her office is on the 3rd floor of that building, the one that, well, you can't see it from where we are now, but it's if you're coming down the access road to the hospital, there's 3 entrances to the hospital. There's the big main entrance down there by the rehab, and then there's an entry to the professional building, and then there's the entry that goes into the back parking lot and emergency room. It's the middle entry that you come into. It's that little parking lot area that gets into her office. And so we'll get that set up and let you get out of here in a little while.
Okay. All right.
All right. Yes, sir. You betcha.
All right.
Had to do something to try to salvage it.
Oh, yeah.
prosecutors believe